This conference will now be recorded.
Hello, everyone. This is Eugene Gallego with Great Plains Tribal Chairman South Board. I see we got Beth Perkins, Clay Moran, and Gypsy. Gypsy wanna? We'll go ahead and wait about 3 more minutes just for everyone else to join the call. Good morning, everyone. Before we begin, we'll go ahead and do a roll call. So I'll start it off. My name is Eugene Gallego. I'm a patient navigator for the Great Plains Colorectal Cancer Screening Initiative, and I'm joined here with Chad Radigan, who's the program manager, for the Great Plains Colorectal Cancer Screening Initiative, along with Deborah Yellow Earring, patient navigator, and Gina Johnson, patient navigator as well. And then we'll just go ahead and let people jump in to do a quick roll call and introduction. And Gypsy, I just now saw your message, and it looks like you didn't call in on phone, but Gypsy Wana with Sisitin Wapton Wayate. Is there anyone else on the phone call that want to give a brief introduction for our roll call?
Yeah, this is Brenna Lanou. I'm a patient navigator for the Great Plains Breast and Cervical Cancer Early Detection Program.
Thank you, Brenna.
Good morning. This is Joy Saylor at the North Dakota Department of Health in the cancer programs.
Thank you, Joyce. Welcome.
Good morning, everyone. This is Stella C1 Zimmerman. I'm the external evaluator for Great Plains Tribal Chairman's Health Board.
Hello, this is Terry and Richard from the Breast and Cervical Cancer Early Detection Program here at Great Plains.
And I see Clay Moran. If you want to give a brief introduction.
Yeah, this is Clay Moran. I'm the CEO of the Trenton Community Clinic here in Trenton, North Dakota.
Thank you, Clay. So I guess we'll go ahead and begin. So greetings, everyone. Thank you for joining our Great Plains Colorectal Cancer Task Force webinar call today. We do appreciate you taking the time out of the day to join us. This webinar is recorded, so just be sure to mute your speakers if those are calling in. Can you guys see my screen fine with the Great Plains Colorectal Cancer Screening Task Force slide?
Yeah, it looks good.
Awesome. Today we will be providing the task force with programmatic updates as well as state and national. I'm sure many of you are curious about the status of the 2018-2019 community grants for both colorectal cancer and our partner programs, the Breast and Cervical Cancer Early Detection and Prevention Program. Also, Devereaux will be giving an update about the task force evaluation, and we will do our quarterly webinar call with open discussion during this time. Just please feel free to share any upcoming events or updates that you have with your tribal communities and your groups. So this photo is a picture of our Great Plains Colorectal Cancer Screening Initiative team, joined here with Brad Kruger, and I think Stella joined in as well. Gina Johnson, Devereaux Yellow Earring, me, Eugene Gallego, and Chad Radigan. And at this time, I'll go ahead and turn it over to Brenna Lanou, who will be giving an update on the Great Plains Breast and Cervical Early Detection Program, RFP. Go ahead, Brenna.
All right, thank you. So the Great Plains Breast and Cervical Cancer Early Detection Program is a breast cancer and cervical cancer screening program that promotes education, screening, and the implementation of evidence-based interventions in tribal communities for the purpose of reducing breast and cervical cancer rates. Our program is staffed by Tinka Duran, the Prevention Programs Director, Kelly LeBeau, our Program Manager, Terry Rattler, our Program Coordinator, myself, Brenna Lanou, Patient Navigator, and Richard Musso, our Data Manager. So we are in our second year, and we released an RFP in July for the purposes of implementing evidence-based interventions in tribal communities to reduce breast and cervical cancer rates. So we received multiple applications and were able to award 5 communities a grant. And those communities are Crow Creek, Trenton, Indian Service area, Santee, and I'm trying to, I don't have it up, so I have to find it. Just 1 second. Omaha, Tribe of Nebraska, and Yankton. And we are currently working on getting all of our revised budgets so that we can get our money sent out to these tribes.
Awesome. Thank you, Brent.
Yep.
And now we'll be talking about our Great Plains Colorectal Cancer Screening Initiative, RFP. I'll go ahead and turn it over to Chad, our Program Manager for Colorectal Cancer Screening Initiative.
Perfect. Thank you, Eugene. Good morning, everybody. First of all, I wanted to thank everybody for joining the call today. We appreciate it. I want to give a brief update on our CRC RFP. We sent it out in August, and I apologize it's taking so long right now for the delay. We had to wait a little while for our budget narrative approval to come through for CDC, and now that we have those, we are just working on finishing our review of everybody's applications. We did receive 17 of them, so thank you for submitting those. We are going to finish those up here shortly. And then also I want to throw in there, if you guys have received a request for a subrecipient profile questionnaire, if you guys could fill those out and get those back to us as soon as possible. I know a couple departments have sent out requests for them, but we do need those in order to award the money. So if you guys could get those done as quickly as possible, that would be fantastic. And then we've done reviewing. Sorry, hold on. All right, there we go. When we get done reviewing everybody's application, we'll go ahead and send out an award letter, and we'll probably do that through email just so that we can get them out quicker, and then we'll go ahead and start on projects. If you guys do have any events or anything that are coming up right now, current or within the next month, if you guys want to send us rolling colon requests, feel free to do that also. We do have our navigators going out to events currently. So, and I also want to remind everybody for the RFP that Eugene Gallego does North Dakota and then parts of South Dakota. Gina Johnson does the majority of hers here in South Dakota. And then Devereaux Yellow Earring does Nebraska and then Iowa. So if you guys have any questions or anything, feel free to reach out to me or reach out to your designated navigator. Thank you.
Awesome. Thank you, Chad. So now we'll be doing evidence-based interventions and just giving a brief overview about what that is and then how it looks on our application. I'm sure some of you might have seen that already, but colorectal cancer is the second leading cause of cancer death among cancers that affect both men and women. Despite strong evidence of the effectiveness of CRC screening testing, it is underused. So racially ethnic minority groups, individuals without health insurance, and individuals with lower education attainment, and those with lower household income levels have lower rates of CRC screening. And so since 2009, CDC's Colorectal Cancer Control Program has supported state health departments and tribal organizations in implementing evidence-based interventions to increase the use of CRC screening tests among these populations. With our application process, I'm sure some of you might have seen that the evidence-based interventions includes the client reminders, provider assessments and feedback, and reduction of structural barriers, and we'll be covering those right now. So with client reminders, they are written letters, postcards, emails, or telephone messages, including automated messages advising people that they are due for screening. Client reminders may be enhanced by one or more of the following: followed up or printed or telephone reminders, additional texts or discussions with information about indications for benefits of and ways of overcoming barriers of screening, assistance in scheduling appointments. Examples of client reminders include utilizing the EHR to identify the population potentially eligible for screening and those due for screening, and mailing a postcard or letter informing the clients that they are due for their screening. This would include a process of monitoring responses to the reminders. To implement and evaluate client reminders effectively, grantees should be able to identify the population eligible and due for screening. Also, track responses to reminders. An example would be client completed an office visit, completed screenings, refused screenings, and did not respond. Another one would be monitor the CRC screening rates in the eligible population. For provider reminders, this intervention informs healthcare providers it is time for a client's cancer screening test called a reminder, or that the client is overdue for a screening called a recall. The reminders can be provided in different ways, such as a client charts or by email. Examples of provider reminders interventions include activating and utilizing the provider reminder function in the EHR to remind providers that the patient is due or overdue for screening. Reminders should include information about U.S. Preventative Service Task Force recommendations for CRC screening. Creating a system where clearly visible reminders are placed on paper charts prior to the office visit with the provider. To implement and evaluate provider reminders effectively, grantees should be able to track the number of orders or referrals for CRC screening tests by providers, track the number of completed CRC screening tests, assess the use of reminders by providers, monitor the CRC screening rates in the eligible population.
Sorry, everybody, my computer just shut off. Give us a second. Perfect. Thank you, everybody. We're just getting the slideshow pulled back up. Give us 1 second.
Sorry about that, everyone. I hope I didn't lose anyone from that was previously joining in. So we'll just go ahead and jump back into where we were. So the next would be provider assessments and feedback. This intervention evaluates providers' performance in delivering or offering screening to clients and present providers with the information about their performance in providing screening performance feedback. Feedback may describe the performance of a group or providers, or an individual's providers may be compared with a goal or standard. Examples of provider assessment and feedback intervention would be something within a clinic assessing individual provider performances for appropriate recommendations from CRC screening and notifying providers how they compare to one another. Another would be among clinics assessing CRC screening rates adherent to current guidelines and publishing results compared to a target rate. Another would be creating motivation through fostering competition by periodically publishing screening rates of competing providers or clinics. And I'm sure a lot of you are familiar with reducing structural barriers. This intervention emphasizes on non-economic burdens or obstacles which make it difficult for people to access cancer screening. Interventions designed to reduce these barriers may facilitate access to cancer screening services by reducing time or distance between services, delivery settings and target populations, modifying hours of service to meet client needs, offering services in alternative non-clinical settings. Examples would be a mobile mammography or vans at work sites or in residential communities. Another would be eliminating or simplifying administrative procedures and other obstacles. Examples of that would be scheduling assistants, patient navigators, dependent care, translation services, limiting the number of clinic visits. Another would be transportation. So this would be providing transportation services, reimbursement to clients, such as interventions often include one or more secondary supporting measures, such as printed or telephone reminders, education about cancer screening, information about screening and availability, measures to reduce out-of-pocket costs to the clients through interventions principally designed to reduce clients' costs are considered a separate class of approaches. So we are all here today with the same goal of preventing colorectal cancer. We all know that screening can prevent colorectal cancer and should be done for both men and women at the age of 50. However, due to many reasons, screening is not a priority for many patients who need it. This can be for a variety of reasons, which can include the lack of education about it, the fear of cancer diagnosis, and structural barriers such as transportation. Transportation barriers lead to rescheduled or missed appointments, delayed care, and possibly missed medication prescriptions and use. Consequences for this can be life-threatening and can lead to poor health outcomes. By offering the gas cards to patients to complete their colorectal cancer screening, patients are more likely to complete it. By understanding the relationship between transportation and health, we are bridging that gap. So we are offering patients a $33 gas card, well, up to $33 for a gas card to complete their screening, and can create a positive impact on their health and understanding the importance of completing their yearly screening and completing the follow-up diagnostic test when needed. So on this slide, here's the gas cards and sample gas card receipts that we include within our application. These forms were included in the community grant application, will be required to be completed and submitted to the Great Plains Colorectal Cancer Screening Initiative team. So with small media-like videos, letters and newsletters can be used to inform and motivate people to be screened for colorectal cancer. Please keep in mind the target audience by designing and creating materials that are culturally and linguistically appropriate for your target population. So utilizing small media can create a positive impact for project goals and objectives to increasing screening. Included on this slide is a poster from our partner at fightcolorectalcancer.org. On this slide, you can see it's appealing and captures your attention, and the information is easy to read and understand. So with patient navigators, what we do is we help individuals overcome barriers to increase access to care screening, diagnosis, and timely treatment. So what we do is we can help assess and respond to patients' barriers to screening, provide patient education, schedule appointments. We must ensure that the patient has effective and understandable and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, language literacy, and other communication needs. Benefits of patient navigation can contribute to increased screening rates, improve colonoscopy prep, increase compliance with screening, improve screening outcomes, reduce the outcome of specialized care due to late-stage CRC treatment. Patient navigation can save the downstream of healthcare costs and provide assistance to patients to increase compliance. So this is some of the things that, as us patient navigators, we are trained on, and we kind of want to push that out to more of the tribal communities that, we're still here to help you with any of those kind of barriers that you are experiencing with patients. So we're here as patient navigators as well. Colorectal cancer is one of the most common forms of cancer. It is a leading cause of cancer deaths in the United States. By providing education and screening about colorectal cancers through education about early detection and regular screenings, colorectal cancer is preventable, treatable, and beatable. Health fairs and screening events are common health promotion strategies used in community settings to disseminate information about screening and others pertaining to those health topics. Providing education and screening at health fairs can change and increase an individual's awareness about colorectal cancer screening. And now I'll go ahead and turn it over to Devereaux for the Great Plains Colorectal Cancer Task Force Evaluation Report.
Thank you, Eugene, and hello to our task force members who are on the call this morning. Thank you for being here. My portion of today's call, I'm going to be going over the evaluation report that we did. We developed a evaluation survey at our annual cancer symposium, and we also sent out the survey via an email through SurveyMonkey. The purpose of the evaluation survey was to figure out how we can make this task force a lot stronger and how we can better serve you as the members of the task force. So with those two surveys combined, we had a total of 46 people who were able to give us feedback from the task force, and I'm just going to go through some of the findings that we had with the survey. So the first portion of the survey was a couple questions here regarding agreeing with some of the statements that we wanted to ask you guys. A lot of the feedback we got was regarding how you benefit from the task force, and it looks like we had over 25 people who agree that the task force is beneficial, and also you believe in the work. There was over 27 people who believed that the task force was doing great work and that it's benefiting their community. And so the second question here asked about the meeting schedule, if you guys want to meet more regularly, or if you guys would like to meet quarterly, keep the schedule the same. It looks like quarterly was what the task force members wanted to keep it as. So thank you for your feedback on that. Then the second set of questions is just an overview of some of the comments or feedback that we got from our task force members. Some of the things, one of the questions was asking about how you learned about the task force. So a lot of one thing that really stood out to me was attending different types of trainings and participating in different educational events is how a lot of people heard about the task force. So I think that's a really strong recruiting tool for us to use as a program, and hopefully this task force will continue to grow. The fourth question here is, what are ways that staff can further involve the task force members? This was one of my biggest questions. Is I want to try to make you guys feel a lot more engaged, and hopefully you guys will be more empowered to continue working towards cancer screening. So, and it looks like some of the feedback we got is more face-to-face stuff would be a lot better, and I think that's something we're going to be discussing as navigators, as patient navigators. I feel like the face-to-face discussions would be a lot more beneficial to some of the task force members. So, and then the last set of questions here is talking about what are some of the strengths, and one of the biggest strengths we had was just idea sharing, and this being a platform for all of our people in the cancer realm to share their ideas and to discuss different things in the cancer work that we're doing. So, and the last question we asked is, what are the areas for improvement? And it looks like a lot of the feedback was a little bit more consistent communication from us, a little more community outreach, maybe some more social media involvement or engagement, and maybe getting out into tribal radio stations or putting information out into tribal newspapers. So thank you again for that feedback. So with this evaluation report, the next steps that I'm going to be presenting to our team here is figuring out a strategy map or some guidelines based on the feedback we got from the survey to figure out what focus areas we're going to have this year, and what are some of the priorities that we're going to have as a task force, and what are some of our goals that we want to accomplish this year, and then those different types of engagement that we can do with you all. So this is just a quick outline that I did regarding that strategy map, and as soon as it gets developed, we'll send it out to our task force members for feedback. We'll work together as a team and really figure out how we can make this task force a lot stronger. So thank you guys for your time. I really appreciate it, and I look forward to continuing to lead and guide the task force to the best that we can as a program. So thank you.
Thank you, Devereaux. The Great Plains Colorectal Cancer Task Force is always evolving, and we're trying to serve our communities and surrounding areas as much as possible. So these are some of the steps that we are doing to improve this platform for everyone. So just want to keep that in mind. So next would be website maintenance. Our website is currently under maintenance, and we are working to update and add resources. So we went through a transition period where we switched buildings and having our address changed. So we took some of the materials, we changed it up, and we also changed the address. So look forward to that coming up. Survivor stories. We are currently working to gather survivor stories and would like to help with recruiting survivors and caregivers to do this. Excuse me. If you know anyone who is a survivor of colorectal cancer or a caregiver to somebody who is diagnosed with colorectal cancer, please refer them to one of our patient navigators to be interviewed about their experience. Survivor stories are a great opportunity to share the importance and the impact of screening has had on the individual, and also has the potential to encourage others to get their screening done. So what I noticed with a lot of our patients that did a survivor story, that talked about their survivor story, is they didn't realize the importance of getting screened and since they did get screened and went through the process of the steps that they needed to take with their cancer treatment, they're very grateful that they did the colorectal cancer screening. So just want to throw that out there. Also next would be our team understands that our partners that we work in clinics are busy, and we want to help their project as much as possible. I want to remind those of you on our webinar that we are available to help with creating advertisements for screening events, and here to help in any way that we can with screening events and encourage patients to complete their colorectal cancer screening. So the GPCCTF team can also create the event flyers, and for those facilities that are interested. And also, we do have quite a bit of materials, so make sure that you do request some of our brochures and fact sheets to give to patients regarding colorectal cancer. We do have more materials up on our website, and we'll be uploading more as well, so we just want to throw that out there. Some of you may have received some of our materials within our last fiscal period, so when we're still creating new materials, so I just want to give a heads up on that, and we'll be disseminating some of those materials as well. Now I want to jump into partner updates. One particular is the access to care and care linkages. So the American Cancer Society and the Great Plains Tribal Chairman's Health Board, more specifically the Great Plains Colorectal Cancer Screening Initiative, have been working together to understand how well patients are able to access colonoscopies after they had a positive stool test. So recently, our patient navigators have sent 4 questions out and asked the access to care and care linkages. Some of those questions were what sites are currently referring to for colonoscopies. If we have a list of referral sites to each clinics, we will be sure to invite those to the referral sites to the meeting. The meeting that we're talking about is the one in North Dakota, which is our North Dakota CRC Roundtable, and it's coming up this month in October 23rd, and it'll be to the 24th as well. So just to give you a heads up on that meeting. One of the other questions is, when a patient has a positive fit, are the clinics finding that the cost is still a barrier to colonoscopies, or are they finding that the purchase referred care is covering the colonoscopies? And another question would be if the cost of colonoscopy is still a barrier, and if local hospitals were willing to donate set numbers of colonoscopies per month for clinic patients, is this something that they are interested in exploring? So with Medicaid expansion in North Dakota has created improving reimbursements for many clinics, and it seems that this has allowed for more purchase referred care approval. We are hearing from IHS and 638 clinics that have coverage of colonoscopies after a positive fit is usually quite good in the state of North Dakota. So what we did is we ended up collaborating with the American Cancer Society, more specifically with the state of North Dakota is where this originated from. But what we did is we went ahead and reached out to the tribal communities, facilities in the state of South Dakota, as well as Nebraska and a portion of Iowa. But we as Great Plains Colorectal Cancer Screening Initiative are housing that information with the questions that we asked. So some of you may have seen an email sent from one of our patient navigators, but we are holding that information. But we want to be able to help our tribal communities and facilities to have that access to care and that care linkages. It is now that time of the year to get your flu shot, and we are happy to share that many of our tribal partners through the Great Plains area will be participating in a FluFit, which is an evidence-based program that expands upon the impact of annual influenza vaccinations by offering CRC screening resources. Because like flu shots, CRC screening with stool tests are repeated every year. For the flu shot, it is an efficient and effective way to increase CRC screening. Conducting the FluFit events is the first step towards other preventative health and screening interventions. For example, once a FluFit event is successful, other services could be able to add, such as the mammogram or smoking cessation referrals. And because this is an evidence-based intervention, we want to be able to create the FluFit more of a sustainable intervention for all tribal communities, so that, you know, if for whatever reason that this funding doesn't continue, we hope that the FluFit will be able to continue as well as a sustainable method. So we also do have a flow chart for the FluFit. So if you would like any more information on that, please feel free to reach out to any of our patient navigators, and we'll be glad to help you with that. And this is just some of the partner updates on some of the events that we had attended. In 2018, the Nebraska Cancer Summit was the 14th annual, and was held on Wednesday, May 30th in Lincoln, Nebraska, and some of our patient navigators as well as our program manager attended this event. South Dakota held their Cancer Summit on September 25th in Mitchell. During this time, the same time, the 2018 Iowa Cancer Summit was held in FFA Enrichment Center in Anarchy, Iowa on September 24th through the 25th. We also had a patient navigator attending the event as well. North Dakota will be having their Cancer Summit on October 25th. So if you are in the area and are able to attend, please register for this. And if you need any more information on that, please feel free to reach out to me or any of the patient navigators. With our 2018 Iowa Cancer Summit, we had keynote speakers. One of them was a Senator, Tom Harkins, and there was also Shante Chambers, who was the Executive Vice President of Health Equity Initiatives and Community Engagement. Included in this slide is the link to access all PowerPoints and presentations during that summit. And if you need this link afterwards, just please let me know, and I'll be glad to send it out to anyone. The Nebraska Coalition recently released their statewide collaborative designed to improve Nebraska's cancer prevention and control efforts. This working document addresses the cancer burden and critical cancer problems in Nebraska. Also for this month, join us in supporting our partners and those affected by breast cancer on October 18th, 2018 by wearing pink to honor breast cancer warriors and survivors and to spread awareness. Share photos of yourself, your team, or family wearing pink and post it to social media using the hashtag Indigenous Pink. Organize an Indigenous Pink Day at your workplace and ask leadership to encourage all employees to take part of this. And now we'll go ahead. So we would like to share this new colorectal cancer screening promotion video that CAT Communications helped develop for us. This video is available on our website as well at gptchb.org. Also, please feel free to share the video as well. And I think we'll go ahead and share the video. Let me see here. Okay. Can you guys see this okay? Okay. Hold on, give me 1 second. I'll see if I can go ahead and play the audios. Is it playing? Yeah, sure. Okay. Sorry about that. We're kind of experiencing some technical difficulties with the audio, but we're going to go ahead and make Tinka the presenter, and she'll go ahead and play it with her audio controls.
Am I the presenter now?
Yes,
Okay,
you
what
are,
can
Tinka.
you see? What screen can you see?
The one with the cat?
So, okay. Well, I got cats on both of them.
The task force webinar call?
Okay. All right, hold on just a second. Let me minimize that. Just 1 second here.
How's it going over there?
Hold on. Sure. Wait now, can you guys hear this when I play it? Can you make sure?
How's it going over there? You know, I just come in here for my daily download and never thought much of it. Then one day, blood, right there, staring back at me like the red eyes of a brown snake. Scared dumb. Well, you know, out of me. Good thing I was already empty. So I went to the doctor right away. And you know what he said? What did he say? He said, you better get a colonoscopy. And I said, a clone's copy? Why would I want to clone that? But he said, no, a colonoscopy. It's when they take a little camera up there to see what the heck is going on. It's not a big deal. It's way smaller than what just came out of me. Anyway, I bent over right there like I was tying my shoes. But I guess that's not how they do it. So I scheduled an appointment to come back. Thing is, I couldn't eat the day before, and I had to drink a concoction that really cleared my pipes. I guess what they're looking for is called polyps. Looks like a little prairie dog in there just poking his head out. Those little guys can make trouble, even turn to cancer. Did it hurt? Nope, you're sleeping the whole time. He snipped a couple polyps out and said there was only one they needed to check for cancer. Everything came back clear, but now I get it done whenever the doc says to. I don't need any trouble when I'm dropping logs, if you know what I mean. I hear you, bro. Doc says catching polyps early saves thousands of lives every year. Too bad not everyone gets the old colon infected. There's another test they got called the FIT test, or as I like to call it, the bag it and tag it. You just collect a little at home and send it in to get analyzed. You don't have to send the whole thing. Learned that the hard way. Man, I should really do that. Right on, brother. Too much? Yeah, cross the line, bro. If you're between 50 to 75 or have a family history of colon cancer, talk to your healthcare provider about a colorectal cancer screening. At-home test kits like the FIT or FOBT tests are available. Screenings save lives.
All right, so can you guys see our screen fine?
I can see this one. Hold on just a second. Let's go over there.
So that was our video that we shared, but if you have any questions on that, or if you'd like information on that video, please let us know. We'll be glad to send that out, and you can share it with your communities as well. But that's pretty much it for our presentation. We just want to keep in mind that colorectal cancer is preventable, treatable, and beatable. And at this time, we'll go ahead and open it up to any questions that anyone has or any open discussions.
These guys must. So it says like some of them, if you want to ask a question, it looks like you may not all have phone capabilities. So if you could type your question in the chat box, if you're able to, that would be good. I'm not sure why we're not having. As phone callers must enter their PINs.
I got a question here.
Oh, okay, go ahead.
So we got a question from Gypsy She was wondering if any other facilities had issues with patients needing to be informed of their IFOB results.
Is there anybody else out there that would like to answer that? So this is Chinka, and I know many facilities send out letters for their negative results and for their positive results. They send out letters, plus they reach out via phone calls to them to let them know that they then need to move into diagnostic and get a colonoscopy. I know from talking with facilities that sometimes that can be difficult getting a hold of the patients that have positive IFOBs or FIT tests, and that some of the patients don't want to go get a colonoscopy. So really, I think what we can stress is the need for good education to those that have positive results. Sometimes maybe if a provider can call them, they tend to listen to providers more. I think a lot of them get scared and they don't want to know the results, which is not good because they need to go on for diagnostics. So I think it's really giving them that education on the importance of getting a colonoscopy if they have a positive result. And that doesn't mean that they have cancer, and trying to answer any of their questions they have, I think will really help them to gain the education they need in order to make that decision to go move into getting a colonoscopy. Does that help, Gypsy?
And another thing too, I think a lot of facilities have a lack of the patient navigation component and the CHRs to be able to reach out to the patients about their IFOB results. So, and that's something that we're working with tribal communities, and we'll be working with them. So if you want any more information on that, we'll be glad to help out with that, Gypsy.
Is there any other questions? Again, I know we're experiencing some technical difficulties, so if you're able to, please either let us know verbally, or if you're not able to do audio, please type into the chat box.
But if there's no other questions, and if you do have a question later on down the road, or think after the presentation, oh, I have a question, I should have asked this question, just please feel free to reach out to any of our patient navigators or program manager, and we'll be glad to help you. But once again, I want to thank everyone for joining our Great Plains Colorectal Cancer Task Force, and you all enjoy your day.